Within yes at them. Ayo, yes at them. Yes at them. Ayo, yes at them. And if your guess is right, this is yes at them. Ayo, yes at them. And if your guess is right, this is yes.
To best describe hypertension, I'm going to use this chart. So this long bar represents the top side of the heartbeat, which is systolic, and this low bar represents diastolic. So just follow me carefully, so that anytime you check your BP, you know what to do.
And if your guess is right, this is yes at them. Yes at them.
This is 140, 180, and 200. Then here, let's start from 70, 80, 90, 100, 110. So when you check your BP, and it ranges from 90, 70, 170, my impression on this is low blood pressure. Low blood pressure. It's also an ailment, but it's not that dangerous, but it's also an ailment. It means the person is hypotensive. Hypotensive. That means you have extreme low blood pressure. Normally, when you are hypotensive, you must take things easy. In most cases, don't try taking any medicine. Just take things easy and then try to reduce your stress level and take more fermented foods. In fact, if you like, give yourself 2 weeks. Take fermented food for 2 weeks, and afterwards, recheck your BP. It will come to the normal target value. If you bring a fantikenke to lab for test for alcohol, at times the alcohol in them are higher than some alcohol we buy outside. If you bring banku to lab for test for alcohol, it's a bit higher. If you cook a stew or soup and you keep it in the fridge, and then you reheat the next day, it's full of alcohol. So take fermented foods, give yourself 2 weeks, and recheck your BP. It will come to the normal target value. Some doctors recommend alcohol to their patients, but I don't recommend alcohol because maybe the patient doesn't know how to drink. Okay, let's assume that my brother comes to me, I check the BP, it's extreme low. Then I tell him, gentlemen, go home, give yourself 2 weeks, take a bottle of beer, and after 2 weeks, come for review. He goes and does the same. He returns, gentlemen, how are you faring? Oh dog, I'm doing well, even for now, I've been doing 2 bottles. By the time you realize it is out of hand, it's also leading to something else. I don't know if you are getting my point. So I believe a doctor may recommend an alcohol to a patient knowing that the patient already knows how to drink. Apart from that, try fermented foods. Now when you check your BP and it is 120, 80, this is normal target value. Normal target value. Normal target value. That is what is expected from all of us. You can hit 125 stroke 83, 84 diastolic. They are all normal target value. When you check your BP and it is 130, 80, this is normal blood pressure. It's also normal. There's no comment on this one. It could be 132 stroke 85, 132 or 135, 86. It's still normal blood pressure. When you check your BP and it is 140, 80, my impression is normal systolic value. Normal systolic value. Normal systolic value. At this level, it is just trying to remind you that try and come down to normal blood pressure or normal target value. Okay, so at this level, it's just trying to tell you, my friend, come down to these 2. Okay, because when you move from this level, then it is leading to something else. I don't know if you are following. When you check your BP and it is 150, 90, 150/90. My impression here is mild hypertension. Mild hypertension. 150/90 is mild hypertension. That means it's giving you the signal that you are becoming hypertensive. So be careful. Are you getting my point? My friend, you are becoming hypertensive. Be careful. It's just a warning. Okay? This is where the road starts. So it's just telling you that you are becoming hypertensive. Okay, maybe you have started some kind of attitude. Maybe you eat late. Maybe you overwork yourself. Okay, maybe you are beginning getting some kind of aggression, whatever. So it's just giving you a signal. You are becoming hypertensive. When you check your BP and it is 180/100, here is moderate hypertension. This is moderate hypertension. At this level, the patient is aware that he or she is hypertensive and he or she is on medication. So the patient is aware. Are you getting my point? So whatever that is going on, the patient is aware that in the house, you normally shout by heart, you often get angry. I mean, so many things. The patient is aware and the patient is on medication. Some too are not on medication, but majority they are aware and they are on medication. They are taking Lefidec, amlodipine, any of them. Okay, so when you check your BP and it is 200/110, my impression here is severe hypertension. 200/110, that is severe hypertension. At this level, it means you are out of control. When you get angry, nobody can stop you. When you plan doing something, nothing can stop you. You overwork yourself by heart. You think by heart. Whatever you do is over. So now it's severe. And at this level, it can cause stroke or heart failure at this level. So I hope it is clear. It's very clear. Yes. So when you check your BP and you fall under this, any of this, then you know a step to take.
Ayo, yes, I them. And if your guess is right, this is yes, I them. Ayo, yes, I them. And if your guess is right, this is yes, I them. Yes, I them. You are welcome to the fitness world, where age is just a number. Ayo, yes.